Hi everybody, my name is Anil Chopra and I'm working as a community pharmacist in Kent Chemist, one of the pharmacies in East Molesey, Surrey.
What are the public perceptions of diseases like breast and bowel cancer, and do they feel uncomfortable discussing it?
In terms of cancer, yes, the public do have a problem discussing that with the pharmacist and they feel very uncomfortable. And I think there is still some stigma attached to cancer itself. A lot of people think that they would be inferior in the society if they have cancer, and then people would change their attitude towards them and then become more judgmental.
So if someone shows up with your pharmacy with some warning signs of breast cancer or bowel cancer, how would you deal with the query, and where would you signpost them?
I mean, in terms of bowel cancer, it's fairly straightforward. If you have a warning sign such as blood in the stools, aches and pains in the stomach which is not resolving from over-the-counter medication, you can easily refer them to the GP and then they can take it further from there. In terms of breast cancer, it's a little bit difficult. I mean, a lot of people doesn't want to discuss about the breast pain with the pharmacist, and it's obviously they think that it's a private matter. So that's a little bit of difficulty there for a community pharmacist to explore. In terms of specifically counselling people with breast cancer and bowel cancer, it's very difficult to recognize bowel cancer patient in community, because obviously the medication is controlled by the secondary healthcare like hospitals and other places, but we could counsel them on the effects of the side effects of the chemotherapy. So if they're coming in to get advice how to manage diarrhea because of the chemotherapy, or constipation, or hair loss, or if their appetite is low, we can give them nourishment. More probably that could be done in community very well. Same with the breast cancer patient. Again, if they are suffering from the side effects of the chemotherapy or radiotherapy or surgery, then that could be resolved in community, and we do a lot of counselling regarding managing those side effects from the chemotherapy.
So this is the final question. So what sort of advice would you give to someone who has or has not been diagnosed with cancer in terms of preventing the condition or just dealing with the condition itself?
In terms of health advice or something that you can prevent the cancer from happening is, I mean, everybody knows about it. It goes hand in hand with your balanced diet, like lots of fruit and vegetables in the diet, which has got antioxidants, and that would hit the free radicals that are forming in your body, as well as exercise. Again, it hits the free radicals in the body. In terms of mentally, it's very, very good if someone who is suffering from breast cancer or bowel cancer, they can go to groups of similar people who have similar conditions, and then they can talk about their condition, how they're managing, how they're all the positive aspects as well as the negative aspects, and then they can live a normal life.
And finally, I know I said that was the last question last time, but this is my final question. Do you think pharmacists play an important role in helping out the cancer patient?
I think pharmacists play a huge role in giving advice to the people who are suffering from breast cancer or bowel cancer or any cancer or any medical condition. I mean, because we are just the first person that a person can go to is the pharmacist, and the potential is huge out there for pharmacists to help these people, and we can do a lot